am Dr. Trupti Deorukhkar from Mumbai, India. I am a practicing homeopath since the last 20 years. I am also head of the Department of Obstetrics and Gynaecology at CMP Homeopathic Medical College in Mumbai, and I am also working as a co-mentor of Urgentum Mentoring. Homeopathy treats a person in the disease and not the disease in the patient. There are different ways and methods of prescribing homeopathic remedies. Some people prescribe homeopathic remedy based on physical complaints. It can also be prescribed based on mental complaints, based on specifics, pathology, keynote prescription, and constitutional remedy. Constitutional remedy is a remedy where we are going to consider the entire patient, the mental and the physical aspect of the patient. Many a times we face challenges in prescribing this constitutional remedy. These challenges could be due to any of the reason, like there is no proper communication with the patient. There are cases which are terminal, extremes of age groups, like for example infants and old age people, when there is a history of suppression. So in these conditions, it becomes a challenge for us to find out the constitutional remedy. Now, in such situations, we can rely on specific remedies for prescription. Specific homeopathic remedies mean a remedy which is precise for a particular condition. I use mother tinctures, biochemic remedies, and homeopathic remedies as specific remedies. There are many benefits of prescribing a specific remedy. The most important is that it improves your success rate. It gives a boost to the patient by relieving his symptoms, and they may open up for the constitutional treatment. There is immediate action of the remedy and there is relief in many cases. Prescribing specific remedy and seeing its result will also boost the confidence of a physician who is treating the patient. Let us take an example of a condition, menorrhagia, to understand the role of specifics. Menorrhagia is a condition where there is excessive menstrual flow. This flow could be excessive in amount or in duration. If the flow is more than 80 ml, or if the female has the menstrual flow beyond 8 days, then we are going to term it as menorrhagia. Menorrhagia is one of the most alarming and distressing symptom experienced by a female. When she is troubled by menorrhagia, this female is going to immediately go and visit the doctor as she wants immediate relief. Now, this menorrhagia should be treated as an acute medical condition. Now, whenever we are going to treat an acute medical condition, we need to give an acute remedy to control the bleeding. Once the bleeding stops, then the constitutional remedy can be prescribed. We have wonderful homeopathic remedies to control the acute episode of menorrhagia. These remedies are really very helpful in managing the acute episodes of menorrhagia. Many a times there tends to be relapse of this acute condition. Like suppose you have a patient who comes to you with acute bleeding. You give the acute remedy, the bleeding will come under control, but the next month or in the next few months she again comes up with this acute menorrhagia. Now, to prevent such relapse, we have to give the patient an anti-miasmatic remedy. A miasmatic understanding of menorrhagia will also help us to prevent this relapse and in deciding the anti-miasmatic remedy to be given. Now, let us classify menorrhagia depending on the miasm. The first and foremost is acute menorrhagia. Now, in acute menorrhagia, the cause could be a local injury to the genital tract. There is history of trauma and bright red bleeding because of that trauma. Then we come to psoric menorrhagia. In psoric menorrhagia, we can consider dysfunctional uterine bleeding as the cause of menorrhagia. Dysfunctional uterine bleeding is a condition where all the investigations of the patient will be normal. There is no detectable pathology. There are only functional changes. We can also consider the incoordination in the hypothalamus pituitary ovarian axis as psoric in origin. Because the hypothalamus is the highest center in the brain which secretes hormones which control the pituitary gland. The pituitary gland in return secretes hormones which are going to control the ovarian secretion of hormones. So if there is a incoordination in any of these axes, then there are going to be hormonal disturbances. Most of the time, the hypothalamic pituitary ovarian axis is disturbed by emotional causes. The hypothalamus is directly under the control of emotions. So, any strong emotion like fear, grief, worry, anxiety is going to disturb the HPO axis. That is the hypothalamus pituitary ovarian axis. When a girl in the puberty age group, that is when she's just started with her menstrual flow, with her menarche. So a girl in the age group of 12 to 18 years is suffering from menorrhagia, we term it as puberty menorrhagia. This is many a times because of this hormonal disturbance caused due to an imbalance in the hypothalamus pituitary ovarian axis. Hormonal influences triggered by emotional causes will be purely psoric. The bleeding in psoric menorrhagia is usually fluid and bright red in color. Now, let us go to the next classification, and that is psychotic menorrhagia. In psychotic menorrhagia, we have to consider a structural change which is causing the menorrhagia. So, you will definitely get some pathology. The patient could be suffering from fibroids, polyps, ovarian cyst, tumors, or thyroid disorder. So definitely there is some cause which you are going to find in the investigations. The color of blood in psychotic menorrhagia is dark red. It is clotted, offensive and indelible. So the character of bleeding in soric menorrhagia we saw is bright red. In psychotic we have dark red and clotted blood. The next is tubercular menorrhagia. Now in tubercular menorrhagia we have to consider pathologies such as pelvic inflammatory disease, pelvic abscess and blood disorders. So all these things giving rise to bleeding will be considered to be tubercle. The tubercular menorrhagia has bleeding which is bright red in color. The last classification is syphilitic menorrhagia. In syphilitic menorrhagia, we are going to see more grave pathology causing menorrhagia. So when a patient is suffering from endometriosis, endometriosis is a condition where the lining of the uterus is present outside the uterus also. It is not supposed to be present anywhere else. But if this uterine lining is present outside the uterus, it could be in the ovaries, it could be in the vagina, it could be anywhere in the abdomen. So in this condition, what happens is the patient tends to have pain and more blood loss. Especially when it is in the cervix or the vagina, she tends to have profuse bleeding. So when there is a condition of endometriosis which is causing menorrhagia, we are going to consider it to be syphilitic menorrhagia. Menorrhagia because of malignancy, cervical cancer or uterine or endometrial cancer causing menorrhagia will also fall in this category of syphilitic menorrhagia. The color of blood in syphilitic menorrhagia is very dark. So dark red bleeding will be again syphilitic menorrhagia. So soric menorrhagia and tubercular menorrhagia will be bright red bleeding. Psychotic and syphilitic menorrhagia will be dark red bleeding. The miasmatic classification of menorrhagia can be helpful in selecting the anti-miasmatic remedy. So if the patient is having soric menorrhagia, you can think of anti-miasmatic remedies such as sulfur or sorinum. In case of psychotic menorrhagia, you can think of remedies like thuja and medorinum. In case of tubercular menorrhagia, you can think of remedy tuberculinum. And in syphilitic menorrhagia, you can consider carcinosin and syphilinum as the anti-miasmatic remedies. Now, how to treat a case of acute menorrhagia? You just need to know the type of the bleeding and the cause of the bleeding, and you will be able to find out the acute remedy. Now, if the bleeding is bright red in color, we have remedies like erigeron, millefolium, sabina, trillium pendulum, macphos and colocynth. If the patient has dark red bleeding, then there are remedies like hemamelis, califerrocinatum, simicifuga, cecal core, Ustilago, and Thalaspi bursa pastoris. Now, let us see remedies for painful bleeding and for painless bleeding. For painful bleeding, we have remedies such as Simicifuga, Erigeron, cecal core, Thalaspi bursa pastoris, Vinca minor, Ustilago, Sabina, and Trillium pendulum. For painless bleeding, we have Himamlis, Millifolium, and Kali ferrocinatum. So you can combine the remedies depending on the cause, the color, and whether there are painful, painless, and you can choose one of the remedies, and I'm sure that it will definitely act. Now let us see menorrhagia, where there is aggravation daytime and the remedies for such condition. We have causticum, cyclamen, lachesis, pulsatilla, and sabina. In aggravation night, we have ammon-carb, bovista, mac-carb, mercury, and ustilago. Now, if the patient has dark clotted blood, you can think of crocus, sabina, pulsatilla, ustilago, and cecal core. If the patient has more of fluid along with the clots, you can think of sabina, ustilago, and lycopodium. Now, if you see, sabina is a remedy which you can consider for clotted blood as well as for fluid serum like blood. Sabina has got bright red bleeding along with dark red clots, or it could be vice versa, dark red fluid blood with bright red clots. Sabina is a wonderful remedy. It's known as a homeopathic curette. Curette is an instrument which is used for the dilatation and curating of the endometrium. When the patient does not respond to the medical line of treatment, DNC is advised. Okay, so Sabina is known as homeopathic curette because it can prevent the curating. You can prevent the operation. Now in this table, I have just taken up the common pathology and the top 2 or 4 remedies which I have seen to be very helpful in such conditions. So the first one is puberty menorrhagia. In puberty menorrhagia, we have Calcarea fos and Senecio. Then we come to the next pathology, fibroid. Phosphorus, Sabina, Calcarea carb, Vinca minor, and Thalaspi bursa pastoris are the top 5 remedies for bleeding due to fibroids. Cervical erosion. For this condition, we have wonderful remedies: nitric acid, sulfuric acid, and natriumur. If a patient has bleeding after abortion, then you can think of nitric acid, Sabina, and ustilago. In nitric acid, we have a symptom where there is menorrhagia after curating. Remedies for uterine or cervical polyps: Calcarea carb, pulsatilla, phosphorus, thuja, and medurinum. So these are the top 5 remedies for uterine polyp. As in any other case, the characteristic symptoms should always be considered and given prime importance. I hope that the above guidelines will just serve as key pointers Now let us see a small case example. Now this was a case of a 46-year-old female who came to me with the complaint of profuse menses since a couple of months. Her ultrasound scan showed fibroids. The bleeding was bright red in color. Now I'm just mentioning the characteristic symptoms of the case. So she was a chilly patient. She desired ice cream. She had fear of dark. These are the characteristic mental symptoms that I am describing. She was better when she was occupied. She had fear of dark and she always liked to be with people around. Now, let us classify the menorrhagia. Now, here the menorrhagia will be psychotic menorrhagia. Why? Because we have the pathology of fibroid giving rise to menorrhagia. Now let us see how we can plan the treatment for her. First and foremost is the acute remedy. Then you are going to consider the anti-miasmatic remedy, and lastly the constitutional remedy. Let us see some rubrics which we can consider and which will help us in deriving the specific remedy. So here if you see, I have considered uterus tumors fibroid, menses profuse and menses bright red. Let us see the top 5 remedies. Phosphorus is covering all the 3 rubrics. Then we have sabina covering all the 3 rubrics. Then belladonna, calcarea, carb, ipecac. So here the acute remedy that I gave her was, any guesses? Yes, the acute remedy was sabina. Okay, see, we can see it in the chart. So I gave her sabina for controlling the acute bleeding. After sabina, the constitutional remedy that I considered was phosphorus. Considering the chilly patient, her cravings and her social tendency. The antimiasmatic remedy which I considered was thuja, because she was a chilly patient. So I gave her thuja as the anti-miasmatic remedy. I hope that you find these remedies useful in your practice. You can make your own permutation combination of these rubrics or these remedies which I have listed, and you can see the result for yourself. I hope that you all benefit from these courses. They are really wonderful and you will find them very useful in your practice. And happy healing to all of you. Thank you very much.